You're watching the Body, Mind, Spirit, Motion. I'm your host, Jill Hewlett, and with me is craniosacral therapist and osteopath, Mark Levine. Thanks again for being here.
Thanks for asking me to be here.
Well, it's a joy, and we are discussing the craniosacral system, the head, back, nervous system connection, and how that relates to, you're going to segue into osteopathy.
Yeah. Well, craniosacral therapy is a subspecialty within the broader context of osteopathy. And osteopathy is a medical system that arose out of the 1920s and 30s in the United States. And if you go to the United States and you see, for example, a DO, a doctor of osteopathy, that person is a medical doctor who has training in craniosacral therapy and other related modalities. For example, visceral manipulation, which is the ability to mobilize the organs of the abdomen and pelvis through the skin to be able to affect changes in the connective tissue relationships.
I love this. You're saying medical doctors would have training in this kind of body work?
Yes, in the U.S. Here in Canada, the licensure is slightly different. But in the U.S., there's you can find an MD and a DO.
Okay.
And a DO is somebody who has training in this. About 95% of the DOs don't actually use this manual therapy practice because it's time consuming and it doesn't relate to the modern flow of medical practice. Most of them practice as physicians.
Oh, okay. Okay.
So about 5% though do use what's called osteopathic manual practice.
Wonderful.
And they're the ones who are typically teachers of osteopathy. And they then, I mean, one of the interesting things about craniosacral therapy is that it was originally taught by John Upledger, who is an osteopath, a DO from the States, who started teaching it to non-osteopaths, people outside the fold, people like massage therapists, which my background is originally as a massage therapist, chiropractors, naturopaths, physiotherapists, even dentists, because it has some application for TMJ problems, jaw joint problems,
Neat.
And psychologists as well, and psychotherapists, because there is an emotional component to some of this work.
That makes sense.
Yeah, as a cellular release happens, or as a soft tissue release happens, where we've stored our emotions tends to bubble up to the surface.
And memories even.
Yeah, exactly.
And associative emotions that go along with those.
That's right. So a big part of the practice of craniosacral and osteopathic manual practice is dealing with the reality of that continuum of body, mind, spirit. Yeah.
And I understand when after you became licensed and you opened your practice, and it's a thriving practice because of the quality work you're doing, you also were asked to do teaching. You moved into a teaching role where you were teaching up-and-coming practitioners.
That's right. I've taught with the Upledger Institute, been an assistant teacher with them for many years, teaching the first 5 courses and the pediatrics course.
That is really neat.
Yeah.
I understand you have some visions towards creating some of your own programs.
Yeah, over time I'm developing teaching materials, and I'll be doing more of that. I'm making that commitment now on television. So I have to really do it. But it's yeah.
Well, of course, and after 18 years experience, 18 is an auspicious number. And it really is. And to come into one's own based on your experience, because that's how these modalities have really developed, right?
That's right.
Through hands-on experience.
That's right.
And then, of course, tying in the science and the understanding from that angle that we know.
Yes.
But really, nothing can teach you the way, having worked these many years.
That's experience is really the best teacher. I've been taught more from the clients I've worked with than any textbooks. I mean, there's tons of textbooks and reading and anatomy and physiology and pre-training that goes into it. And I have 5 years of university, pre-med university as well. And nothing can teach the way that experience can teach.
Yeah, just
it
to
really
be
makes
in that
a huge
moment.
difference.
Yeah, it's not the textbook, it's
No,
street
it's
smarts.
Exactly.
And not to mention you have a wonderful wife and 2 daughters.
That's right.
So you're surrounded
We're now
by
almost
learning.
adults anyway, so I've got...
So you've been through the parenting curriculum.
That's right, yes. And I've been through that parenting curriculum with some wonderful help in the past. Some people who were in my life at the time when my children were very young, who really taught me. My wife was one of them. She really understood what was going on, and we had a friend who was a midwife, and she gave us invaluable help. Yeah.
And it takes a village. It really does to raise a child. And on that note, you know, you're paying it forward and being instrumental in other people's lives that way, right?
Yeah, yeah.
And because we know how much we need it. And on that note, Brindavan, my daughter, came to see you when she was 11 days old. Because there was just some adjustments that were needed and some, I thought some colicky type signs. And it was wonderful. And she is thriving and got her twigs straightened up so her tree can can grow in a balanced and healthy way. And I understand this is something that people can do at any age and continue on and do preventatively as needs be.
That's right. I see babies as young as the day of birth. And in fact, in osteopathic hospitals in the States, routinely, along with the APGAR scores, they do a craniosacral session right at birth, which is a wonderful way of relieving some of the tensions that develop during the birthing process. So, earlier is better if there are any concerns with an infant. And I see people for trauma and that sort of thing where there's a concentrated program. And also, I see people kind of on an ongoing basis for health. Yeah.
And it makes sense because it's to support our immune system ultimately.
Oh yes.
Right?
Yeah.
And you know, I feel that the body is it's like Maslow's hierarchy. When we get the base in order, the physicality.
Yes.
And that was just so appropriate to have you on again because I think in modern day society we need a reminder of that because we're, you know, a lot of people are living in the past, living in the future, getting a lot done, but not necessarily being fully here, not even breathing fully.
Exactly.
After my session with you, you know, I was in the checkout line at a store I went to that afternoon, and I could just feel my whole body breathing.
Right.
I had no awareness of it.
Yes, a sensory awareness.
Yes.
Sensory is all in the present.
And it felt so good, and I thought nothing else mattered. I didn't mind how long I had to wait in that line because I was just breathing and enjoying it.
Yeah.
And I would imagine people could benefit from more of those experiences throughout the day.
Exactly. Infants too.
And then, yes. So